Welcome to The Explainer. So today we're diving into what is basically a global health mystery. It's a real-life detective story, you know? We've got a deadly disease, a super dedicated team of investigators, and literally millions of people who every single year just seem to disappear. All right, so the disease we're talking about is tuberculosis, or TB. And the real head-scratcher, the question at the heart of all this is how? How can millions of cases of one of the oldest diseases known to humankind just vanish? I mean, they're not in the official records, and that's a huge problem, right? Because if you're not counted, you're probably not getting treated, and it means the people fighting this epidemic are essentially flying blind. So let's put a number on this to make it real. Take a country like Tanzania. The initial estimate? A staggering 24% of all TB cases were going completely uncounted. That's almost a quarter of all patients. Just gone, off the books. So where do you even start looking for them? And look, we're not talking about a small rounding error here. This is a massive, massive blind spot for global health. When you're trying to stop an epidemic, flying blind isn't just a bad strategy, it can be a fatal one. Okay, think of it like this. You know the whole tip of the iceberg thing? That's exactly what's happening here. The official numbers that governments report, that's just the bit you can see above the water. The real danger, the massive bulk of the problem, is everything lurking underneath. And if you're serious about fighting TB, you can't just deal with the tip. You've got to see the whole iceberg. So who are the detectives on this case? Well, meet the team from the World Health Organization. Their official job description is, pretty formal. Produce a robust, rigorous assessment, that whole thing. But what it really boils down to is this. Their mission is to give countries the tools they need to see that entire picture we were just talking about. Now, to crack a case this big, these detectives needed a special kind of tool, a framework that would let them see all the hidden parts of the problem, all those layers beneath the surface. And what they came up with is called the onion model. So what exactly is this onion model? Honestly, it's one of those ideas that's so simple, it's brilliant. It's basically a way to visualize every single TB case in a population. You structure them in layers, just like an onion. At the very center, you have the cases we know about. Then, as you peel back the layers, you get to the ones that are harder and harder to see, until you're at the completely invisible cases. It's a genius way to pinpoint exactly where people are falling through the cracks. All right, this is where it gets really cool. We're going to peel back the layers of this onion, one by one. And as we do, we can literally trace the journey a patient takes and see all the different places they might get lost along the way. So, let's break it down. Okay, so at the very core, the heart of the onion, that's layer 1. These are the notified cases, the ones we officially know about. Simple enough? Now peel one layer back. Layer 2, these are folks who got diagnosed in a public clinic, but for some reason their case never got officially reported. Layer 3 is pretty much the same, but for patients diagnosed by private doctors. Now layer 4, this one is huge. These are people who actually went to a health facility, but they were never diagnosed correctly. And as you get to the outer layers, you find people who have access to care but just don't go. And finally, the outermost layer, people who have no access to care at all. See? Each layer is a different piece of the puzzle. And here's the truly brilliant part. The onion model doesn't just tell you what's broken. For every single layer, every problem it uncovers, it points you directly to a solution. It's not just a diagnostic tool, it's a blueprint for repairs. So if you see a ton of people getting lost in that undiagnosed layer, what does that tell you? It tells you, hey, you need to invest in better labs and training. It transforms this giant, messy mystery into a clear, actionable roadmap. Okay, but this is the million-dollar question, right? It's all well and good to have this nice, neat model, but how on earth do you get the actual numbers to fill it in? You can't just guess. How do you count people who are, by definition, invisible to your system? Where does the data even come from? Well, this is where you have to become a real data detective. You get creative and pull clues from all sorts of places. For example, you can track where TB drugs are being sent. If a bunch of drugs are going to an area with very few official cases, that's a huge clue. You can look at death records to see how many people died from TB without ever being diagnosed. You can use big health surveys to figure out who has access to care in the first place. You're basically piecing together all this different evidence to make the invisible visible. So let's take this out of theory and into the real world. Let's head back to Tanzania, where this whole thing started, and see how the onion model actually helped crack the case. All right, check this out. Between 1995 and 2010, Tanzania made some serious investments in its ability to actually find TB. I mean, look at the number of labs capable of diagnosing it. It nearly tripled. That's a huge deal. Because remember, you can't treat a case you haven't found. This was a direct attack on that presenting but not diagnosed layer of the onion. And it wasn't just about equipment either. They invested in people. The number of full-time nurses specializing in TB went up 5 times. That is a massive increase in expertise right there on the front lines. It means if you walked into a clinic with a cough, your chances of getting seen by someone who really knew what to look for went way, way up. And here's the payoff. This is where it all comes together. This table shows the before and after picture in Tanzania. So remember that big presenting but not diagnosed layer? Well, after accounting for all those new labs and nurses, the estimate for that layer just plummeted from 9% all the way down to about 2.4%. And the bottom line, the total number of missed cases dropped from that scary 24% down to under 14%. That's a game changer. So what does this all mean? It's huge. By using the onion model to look at all the data systematically, the team had a massive realization. Tanzania was actually doing a much better job of finding its TB cases than anyone gave them credit for. Their case detection rate, that's just the percentage of cases they're actually finding, jumped from 75% to over 86%. The mystery was partly solved. A lot of those patients weren't actually missing. The old way of counting was just wrong. Okay, so this brings us to the most important question of all. Why does any of this matter? I mean, who cares about a bunch of numbers on a chart? Well, this is way more than just an accounting exercise. This has huge, real-world consequences. Think about it. When you're only seeing that tip of the iceberg, you're just guessing. You're putting money in the wrong places, you're letting the disease spread silently in communities, and you have no idea if you're actually winning. But when you see the whole onion, everything changes. You can target your money and effort precisely where it's needed most. You can actually break the chains of infection. And you can set realistic goals that lead to what really matters, saving lives. And really, that's the key takeaway here. Finding the missing patients isn't about making the stats look better. It's a roadmap. It's about recognizing that every single one of those missing cases is a real person. And understanding where they are and why they're missed is how we figure out how to find them, treat them, and ultimately end this epidemic. When you get right down to it, the onion model is really just a powerful way of looking at a problem differently to make it solvable. And it really makes you think, doesn't it? If a simple model, a simple shift in perspective, can help us find millions of missing people, what other giant, complex problems out there are just waiting for us to find the right way to look at them?